Hey everybody, it's Dr. Elizabeth Hooper. I hope you are having a good week. And today is a focus on access to care for Obesity Care Week. So this is kind of a heavy topic, as most of them are this week, and I just wanted to take this opportunity to kind of talk about some of the access to care issues, especially that we face here in the United States. And so what I wanted to show everyone was a couple of different things on access to care. And so let's just start by talking about a few different things. So first of all, Obesity Care Week. If you want to learn more, there's a great website called obesitycareweek.org, and you can find out there's some alerts, how to get more information, and how to increase awareness and advocate on behalf of people who have obesity. You can use some hashtags, you can use social media, talking about things in your daily life. And today, one of the things we want to highlight when we're talking about access to care is advocacy and advocating on behalf of our patients, our friends, our family who would benefit from more healthcare coverage for weight-related medical care. So a couple of numbers to talk about. The amount of annual healthcare costs for people with obesity is 30% of the national healthcare costs, which obviously is a lot. And that's about $480 billion of healthcare related to obesity. There are 230 medical problems that are related to being overweight or significantly overweight. And about 50% of adults are projected to have a BMI of 30 or more by 2030 if we don't make any changes today. So that all sounds kind of depressing, or maybe like this problem is too out of control. What can we do? But it's really not, because we know from previous experience that people who have weight loss surgery to treat their medical problem of obesity have a very improved quality of life. Over 95% of patients say that their quality of life is improved, and 89% risk reduction in dying over a 5-year period. Hi, everybody. And so we know that we are changing people's lives when we treat the medical problem of obesity. And on the insurance side of things, we know that insurance companies recoup their cost of paying for surgery within 2 to 4 years because they are not paying for diabetes medications, or they're paying for less high blood pressure medications. They're not paying for hospitalizations for other medical problems nearly as much. So, what we are doing as bariatric surgeons, yes, we ask you how much weight you've lost since your last visit, or, are you at your goal weight? A lot of people have one of those. But what we're really trying to do is improve quality of life and improve overall health. So there is a group that specifically advocates for people called the Obesity Action Coalition, OAC. And they put out statements to help guide people so that they can look at insurers, employers, and governments, and how do we talk about this medical disease and how do we improve access to care. So when we're talking about insurers, looking for plans, if you're the person in your office that helps decide that, that should be something that should be looked at, and can we include that in our plan? And employers, providing treatment and prevention, and that should not require higher premiums. This is a medical disease. We don't require higher premiums for someone with high blood pressure or diabetes. And to make healthier food options available in offices. In government, same serious action that we do for other diseases. So, since the American Medical Association identified and defined obesity as a disease, we've been able to see some improvements in funding for research. And we should also consider an option of subsidizing healthier foods and maybe even requiring those in government food programs. Highly processed foods are more shelf stable, but they tend to have a lot more fat and sugar in them. And then on the individual level, advocating and encouraging patients and family members to discuss with their doctors how their weight affects their other medical problems. Um, Increasing how we talk about food and its actions on our health, as well as physical activity. Um, on a personal level, for many of our postoperative patients, taking action and including education and speaking up to point out poor ad choices, for example, or when there is a new choice at the office. Hey, that's not very healthy. Do we have another option? For people who have school-age children or an interest in that, continued improvement in the nutritional requirements and availability of good nutritional snacks for kids at school, encouraging physical education. The recommendations from the pediatric community is 60 minutes of physical activity every day for kids. Within our communities, planning to include green space and parks and sidewalks so that we are kind of encouraging people to continue to be active. And then in marketing, not marketing sweets to kids, food labeling, changed that in the last couple of years to see calorie counts and actual serving sizes versus what people may routinely eat with that food. So how do we help? How do we jump in? This is a huge area. So, you can speak up with ads on Instagram and social media to further destigmatize obesity and remind people this is a disease. That can be when you see something that really stands out as inappropriate, tweet them. That seems to work pretty well. Or send an Instagram message. This is disappointing. This product is furthering this stigma. Speak up and get involved at work. Every year in corporate America, businesses are looking at their health insurance plan and they are looking at what they're going to include and not include. This is an opportunity to say, hey, are we going to include this in our plan? And if it's not going to be included, you can go to the Obesity Action Coalition site and get all kinds of data for your company about why obesity coverage should be included. Or, if it's maybe going to get removed if you're changing plans from one company to another. There's a great resource sheet. You don't have to stand up and give a presentation. You can say, here's the facts on taking care of people with this medical disease, and then be an advocate for that. We have patients every year in January that had surgery or surgery coverage the year before, and their insurance changes, and now they don't have coverage. And that is so frustrating and discouraging for people. And then resources. So, there's state resources on the online that you can get, like a one-stop shop, and you can send an email to your state rep, your federal rep, your local rep. There's even pre-printed emails that you can fill in a little bit of information and send it to everyone who represents you at all levels of government, and remind them that it's important to care for these other concerns, that obesity is a disease. It is affecting a significant amount of our federal budget. It's significantly affecting a amount of our state budget and insurance companies. And so there's lots of ways to get involved. If you really like to talk to your representatives then one way that you can do that is with phone calls. So emails are great, especially for those of us that are a little bit shy, or what if they ask me a question I don't know the answer to? That's okay. You can say, I don't know, I'll get back to you. But phone calls are great because that means someone there has to listen to your message. Emails are also awesome. So the Obesity Action Coalition Action Center is a great way to do that. There's also a bill that's coming to the House of Representatives nationally soon, and it's called the Treat and Reduce Obesity Act. So that is when you can very specifically submit an email and say, I want you to support this bill. I want to increase the coverage for people who have this medical problem. And I think the more we say things like that, the more we say obesity is a disease. This is a medical problem. This is something that is going to affect half of our population, and we will see half of our population have a BMI of 30 or more by 2030. We need to step in and be more active. When we make more noise, we are adding access to our patients. We are removing them from margins of healthcare and improving access to care. This is one of the ways we improve insurance coverage and make sure that we can take care of more people. We know that of the people who meet the medical requirements for weight loss surgery, only about 1% of them have surgical intervention. And so we know that we can do better than that. But not everyone has coverage. Not everyone knows about it. You know, as a physician, I think one of my roles about advocating for the care of people with obesity is talking about it with patients who may not be seeing me for that. So, if someone comes to see me for their hernia, I feel that it's important to also say, because of your smoking, your risk of your hernia coming back is higher. Because of your weight, your risk of your hernia is coming back higher. Now, let's talk about what we can do about both of those to decrease your risks. And so, as physicians, one of our important roles is to not only say and identify this as a medical problem, but how can we help our patients overcome that medical problem? And again, increasing access is one of the best ways to allow us to step in and make those changes. So, it's not necessarily the easiest thing to do, but if you have 15 minutes after you watch this video, or 5 minutes, and you take just a minute to go to the Obesity Action Coalition and 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 look around and find the section that's access to care. And actually, I'm going to try to share my screen and show you guys because I think it's so important. Okay, sounds good. Yeah, let's see if it'll show both here. Okay. Can you share my screen if Dr. Kukreja was kind of watching from afar? I can't, doesn't look like I can share it on my side. So thank you. It's obesityaction.org. And you can see right here this action through advocacy. It's the fourth one over, and there is lots of information about weight bias, public policy comments, access to care. Here's that resources you can hand off to your office when they are looking at their insurance plans for next year. And then this Obesity Action Center. This tells you how you can get started. So you click here, you can put in your information and it'll pull up all of your representatives, and you can look at different policy issues that the Obesity Action Coalition is trying to address. You can co-sponsor this Treat and Reduce Obesity Act. And so you can take action and You've got some key facts so you can learn a little bit about what this bill means. And then right down here, you put in your information and go from there. And it's really great resource to go to. There's lots of other resources here on the Obesity Action Coalition. I know some of our post-op patients have been really involved with this group, and we appreciate that because we cannot do it alone. We need our patients and their families to talk about how important this coverage and care is. This is one of the ways that we show care for other people by increasing that access and availability of medical care for the treatment of the medical disease of obesity. Does anybody have any questions you want to pop in any chat boxes, and I'll try to answer them about access to care? I really appreciate everyone listening in today. Waiting. So please share this video with your friends and family. You can put the hashtag Obesity Cares Week or hashtag OCW. Talk about this. Look through this again when you have some time to sit with it. Look at the Obesity Action Center or Obesity Action Coalition website. Tomorrow we are going to meet again, and tomorrow is World Obesity Day. So all across the world, all of the societies all over the world are going to be focusing on the treatment of obesity and this medical disease and how we can make an impact worldwide. We're going to have some live guests with us that will also talk about their story and how they have overcome and treated this medical problem in their own life. So I'm really excited to be hosting that tomorrow. And again, increased access to care is our key for today. I hope that this has given you a couple of really good starting points and opportunities to be more vocal. Okay, here's a good comment. Stats are important to know that so many health issues are practically gone after bariatric surgery is amazing. Absolutely agree with that. That is super important. We can show that we have a lot less other medical problems, and that for insurance companies, they are saving money. For employers, they are having less days out for doctor's appointments after surgery, less time off because of illness. As patients, less medications that you're paying for. Those things are all getting, unfortunately, more and more expensive over time. So there's lots of educational options, lots of statistics, lots of infographics that show what those statistics of improvement are and what do we spend and where do we see those medical problems. So thank you. That's an excellent point. So again, I hope you can share this with friends, family, watch it again. And we appreciate you and hope you're all having a wonderful, safe, and healthy day. Talk to you soon. Bye.